You go to poetry.com, put this name in, and you'll pull up my poems that I've had published. This is part 2 to this sloughing off of my intestines. This paperwork here. So we have this at the very beginning, knowing that this is part 2. My doctor and the PA who was assisting in my treatment. So this carcinoma that's in the colon, that carcinoma, this is what it's doing. Abdominal CAT scans from August 29th of 2013 shows the lining up to both layers being missing in quite a bit of the colon. You can see the cancer very well in a transverse colon. So I've been bedridden mostly for the past couple of days. Had to go to the ER on Friday night, down in this area, just right quick, of the lower left quadrant. Right here's the hip, so it's down here, down into the bend of the leg here. This is very decompressed. It's quite narrowed. I have a very large neoplasm in the middle of my abdomen. This right, let's see here, this right here, this neoplasm is right here, is the umbilicus. Right there is the mass. I've got another one, that a bulge that has come up just underneath the left rib cage, and it's made very difficult to breathe the last few days. And this is the reason, this right here is the reason why that it felt like that something was busting through my colon. And believe me, it's quite a creepy sensation. All I could think about is the movie Aliens, where that thing, oh Jesus. And Dr. Robinson abandoned me within on October 12th, 14, something like that, and I have had nothing to fight this pain with, nothing to fight this on a daily battleground. My left leg is swelling, and I can tell that it's coming right from that floor, the abdomen, where this, whatever is causing these amber-like sensation, you know, hot coals, glowing coals, you know, sitting in my colon and on that abdominal floor. It goes right down this leg, and it swells so much that I cannot bend down on the knee. It almost feels like it's just going, the skin is just going to give way. And I really wondered if I was going to be able to make it to my birthday. And well, I made it to my birthday. I don't know if I'm going to make it to after my birthday. Remember that I've had hospice as soon as we were down to the last signature needed by Dr. Robinson. It was taken away from me, and this was in August. And he has succeeded in making me suffer quite terribly. I don't know why that a doctor would ever deny a patient of treatment for this type of affliction or any affliction. You know, he is the one that diagnosed it. And I believe he was telling me the truth, even though that he's been all of a sudden telling me that he never did that, in which he most certainly did. My mother was sitting there right at the time watching us go over these films, these CT films from Great Plains Regional Hospital. That was done in August of 2013. He diagnosed it. Oh yeah, the intestines are, the linings are missing and stuff, you know. So I believe that he was telling me the truth. And actually, this all really started in 2009. I've got pictures of the lining stretched out on a piece of cardboard that was over a foot long. That's how I knew that it wasn't mucus, it was my intestines. And I have been, this is how long I've been fighting, trying to get treatment, and I've had to be my own doctor, and I've got a little edge on that, as I have spoke about in some of my other videos, that in the late 80s, early 90s, I was studying to obtain my doctorates in radiology and gastroenterology. I was told that I had a doctor, a very good GI doctor, diagnosed me with Crohn's disease back then, and that's what, treating my own diagnosis is what got me to add on the doctorates in gastroenterology, because actually I was his first patient with it, and we were both learning, and things went very well. I was able to manage this quite well, but I had a tumor removed on December 1992. And they had said that the cells may fragment off. It's very difficult to get every single cell, and quite possibly that the tumors could spread. And this is what has happened. And I've got a tumor on the left parotid gland, and it presses on the trigeminal nerve, and I've got the trigeminal neuralgia also from the surgery. I wear this eye patch because my pupil is dilated, and if I expose it to light, it has caused me to be in the emergency room numerous times in just horrific severe shape. So this is the only reason why that I wear this patch. But so out of all these benign tumors, finally there's one that is a carcinoma, and I have not been able to get help. This is what has been going on, and I know that it's obvious that they want me dead. Otherwise, I would not be sitting here at my home watching my insides coming out. And I am in a tremendous amount of pain, and I am very weak, and I am going to stop here. and I'm going to go lay down. But this is to record what has been being done to me, and that this is started much over me trying to protect those disabled kids. They didn't have to take me out in a pasture and shoot me. All they had to do was make sure that I didn't get the proper medical treatment. So if you would keep me in your prayers, please pass this along. I have been trying to get reporters, news stations, organizations, somebody to lend me a hand with what's going on, and keep my promise to those disabled kids and get some justice for them. So I know that we're all struggling. Hang in there as long as you can. God bless, and much love to all of us.